Chapter 16, Emergency Pharmacology. So some general information about drugs that you need to know is about drug names. Each drug is listed by its generic name, and each drug has at least 3 different names. Its chemical name, its generic name, and its brand name. One or more trade names given to the drug by the manufacturers. Before administering a medication, make sure that you understand the drug's indications, their contraindications, and their side effects. Also included is their untoward effects. So the different forms of medications. You can have compressed powders or tablets, such as glucagon or aspirin. You can have your liquids, such as your pre-filled medication, such as Narcan. Your gels, like your oral glucose. Suspensions, fine powder. Gases, like oxygen. And your sublingual sprays, such as nitro. Medication, safety, and clinical judgment. So administering or assisting with medications is a serious responsibility. You need to know the medication, need to know the side effects and how the medication acts, and you need to use good judgment when you're administering medication. One of my important sayings that I use in relation to pharmacology is, just because you can doesn't mean that you should. Medication authorization. So offline medical direction means that you do not speak with the physician directly. You use standing orders or protocols to administer medications. Your online medical direction is when you speak directly to a physician. You listen to the order, you repeat the order back, and then you ask for clarification if necessary. So the 5 rights of medication. Do I have the right patient? Is this the right time to administer this medication? Is this in fact the right medication? Is this the right dose? Am I giving this medication by the right route of administration? So think about it. What would be the potential risk to the patient if each of the 5 rights were not checked prior to administration? Different routes of administration. You can have oral medication or something that's swallowed. You can have sublingual or medication that's dissolved under the tongue. Inhaled medication or breathed into the lungs, usually as tiny aerosol particles such as an inhaler, like our nebulizers, or as a gas such as oxygen. Intranasal medication or something that's sprayed into the nostrils via a MAD device. Intravenous medication or something that's injected into the vein. Intramuscular or injected into a muscle. Subcutaneous or injected under the skin. Intraosseous or injected into the bone marrow cavity. Endotracheal or sprayed directly into a tube which is inserted in the trachea. So age and weight related considerations. Pharmacodynamics is the study of the effects of medications on the body. So what effect will the medication have? How will this medication affect my patient specifically? Patient-specific factors change how medication works. So after you've administered a medication, you need to make sure that you're reassessing the patient, and you need to clearly document the medications as they were administered, including time and dosage. Medications that patients will often take. Advair is a medication that may be prescribed to a patient for daily management of a respiratory disease. It should not be used for emergency treatment of an acute attack or breathing difficulty. Assisting with IV therapy. While IV therapy is an ILS or an ALS level skill, you may be called on to assist with different things if a intercept with ALS is initiated. So the ways that fluids and medications can be administered into the vein. You can do a heparin or saline lock, where the catheter is placed into a vein, a cap or a lock is placed over the end of the catheter, and the lock contains a port for being able to administer medications. So traditionally you'll have an IV bag, which hangs above the patient, and it constantly flows fluids and medications into the patient. Setting up an IV fluid and administration set. So a lot of times this is called spiking a bag. You'll have clear plastic tubing connecting the fluid bag to the needle or catheter. So there's three important parts. You've got the drip chamber, you've got the flow regulator, and you've got the drug or the needle port. The extension set makes it easier to carry or disrobe a patient without pulling out the IV. So inspect the bag to be sure that it contains the solution that was ordered. Is it clear? Make sure that it does not leak, and make sure that it's not expired. So setting up the IV administration set includes removing the protective coverings from the port of the fluid bag and the protective covering from the spiked end of the tubing. You'll insert the spiked end of the tubing into the fluid bag, and you'll open the flow regulator. Then you'll turn off the flow, and it's ready for administration. You'll want to make sure also that once you've turned off the flow that all air bubbles have been removed from the IV tubing. We don't want to get those into the patient's veins. So maintaining an IV, troubleshooting flow problems. Constricting bands were left in place by mistake, such as the tourniquet used when they go to start the IV. The flow regulator was accidentally left closed. The clamp was closed on the tubing. Perhaps the tubing kinked, or the line pinched under a backboard. While you won't be typically adjusting the flow rate, the medic may ask you to take a look at it to see how fast it seems to be dripping. And you want to monitor the IV sites along with ALS for infiltration. So is the site around the IV filling up, becoming hard because fluid is infiltrating not into the veins but into the muscular tissue? So let's review. Aspirin, oral glucose, and oxygen are medications carried on the ambulance that the EMT may administer to a patient under specific conditions. You'll also see in the video that I've provided after this emergency pharmacology tutorial the other medications that we carry. Prescribed inhalers, nitroglycerin, epinephrine autoinjectors are medications that, if prescribed, the EMT may assist the patient in taking. You may be able to administer intranasal naloxone or Narcan, or encounter patients who have received it from a layperson. You may need to have permission from medical direction to administer or to assist the patient with a medication, so make sure you follow your local protocols. There's a wide variety of medications that a patient may be taking. You will try to find out what medications a patient is taking when you take the sample history. These drugs may be identified by a variety of generic and trade names. If you don't know what the medication is, look it up. There's plenty of free apps out there that can help you identify what these medications are, what they're used for, dosing, side effects, and anything else related to the drug. Remember that your main purpose in finding out what medication the patient is taking is to report this information to your medical director or hospital personnel. Remember, EMTs administer aspirin, oral glucose, and oxygen as a part of patient care, and they may also assist with prescribed inhalers, nitroglycerin, and epinephrine autoinjectors. EMTs should understand the names, the indications, the contraindications, and the side effects of medications that they intend to administer. EMTs must have appropriate authorization to give a drug and must always follow the 5 rights of medication administration. Reassessment and documentation are important elements of medication administration. Questions to consider. Should I administer a medication? Again, like I said a little bit earlier, just because you can doesn't mean that you should, so make sure you're administering them appropriately. How can I get more information about a drug? What are the necessary steps that must occur after medication administration? So let's do a little critical thinking scenario. A patient is complaining of chest pain. Here's some nitroglycerin, says a family member. Give him that. What do you do?